My name's Elliot, I'm an osteopath at the Revitalize Clinic. I'm going to go through a movement today to improve external rotation of the hip. So a lot of people, when it comes to hip movement, will do a fader test where we'll see how far the knee can drop out, and ideally we're looking for the thumb to hit the knee. Now if we can't do that, there's an advanced exercise to improve external rotation, and that's something that we use a lot in jiu-jitsu, which is stand-up technique. So from here, we'll start with our knee just out, our heel under our bum, and then our foot here. And what we want to do is stand up into this position, leave that knee behind, and I'm allowing gravity to take hold. There's a little bit of distraction here, a bit of stretch in my adductors, and I'm moving into that external rotation in a concentric and eccentric manner to maximise change. Now, a lot of people will find this quite difficult. So I'll show you on the other side. So here, just hooking my heel front, pushing off of my left hip. So a lot of people will find this movement quite difficult. So we're going to use a few adjustments for that. So the first adjustment is we can use TRX. So from here, I can then use this support up front to pull myself into the position that I want to be in. And I could use this as a warm-up or a bit more of an articulation. The other is I can use a bolster. So I can place some cushions under my hips, so my leg isn't falling into as much external rotation. And then sometimes people like a bolster for their knee as well. So once again, they're reducing that external rotation. So if it's an exercise, 3 sets of 10. If you're more doing it as a mobility movement, and you can even go from top down, so where you're just gently mobilising like this. You can do 30 seconds to a minute, but what we would be looking for is a quantifiable increase in that person's range of motion around the hip. That's it.